Hi, my name is Savannah Line, and I'm going to be presenting to you today on peripheral arterial disease, also known as PAD. So, first off, what is it? Peripheral arterial disease is a condition that develops when the arteries that supply blood to the internal organs, arms, and legs become completely or partially blocked as a result of arteriosclerosis. So, as you can see to the picture to the right, the artery up top is what a normal artery looks like, and then the artery on the bottom with the yellow is what people with PAD have. So 40% of people with PAD experience no symptoms or leg pain, and nearly 10 million Americans are living with PAD and are at an increased risk for developing a non-healing wound on the legs or feet. Along with this, 1 in 3 people with diabetes over the age of 50 have peripheral arterial disease. So, how to look out for it. Signs and symptoms of PAD are painful cramping in one or both of your hips, thighs, or calf muscles after certain activities such as walking or climbing. Also, leg numbness or weakness, coldness in your lower leg or foot, especially compared to the other side. So looking at the picture to your left, you can obviously tell that the 2 feet are not the same. So that's an easy way to compare. So more signs and symptoms: sores on your toes, feet, or legs that won't heal, a change in the color of your legs, hair loss or slower hair growth on your feet and legs, slower growth of your toenails, shiny skin on your legs, no pulse or a weak pulse in your legs or feet, erectile dysfunction in men, and pain when using your arms, such as aching, cramping when knitting, writing, or doing other manual tasks. So, when to refer someone. If you're having leg pain, numbness, or other symptoms, do not dismiss them as a normal part of aging. You want to call your doctor and make an appointment. And once you're at a certain age or have a certain risk, your doctors will check for this every time you go to visit. So when you go to visit, your doctors will always tell you to take your socks off if you are in that at risk, so they can compare and check out your legs and feet. So even if you don't have the symptoms of PAD, you may need to be screened if you are over the age of 50 and have a history of diabetes or smoking, or are under the age of 50, have diabetes and other peripheral artery disease factors such as obesity or high blood pressure. So there's a lot of different testing for this. In your physical exam with your doctor may notice some symptoms and signs of PAD, such as weak or absent pulse below the area of your artery, whooshing sounds over your arteries that can be heard with a stethoscope, evidence of poor wound healing in the area where your blood flow is restricted, and decreased blood pressure in your affected limb. So, like I said earlier, there are many different ways to test for this. One of them is the ankle brachial index, also known as the ABI. This is the most common test used to diagnose PAD. It compares the blood pressure in your ankle with the pressure in your arm. To get a blood pressure reading, your doctor uses a regular blood pressure cuff and a special ultrasound device to evaluate blood pressure and flow. You may walk on a treadmill and have readings taken before and immediately after exercise to capture the severity of narrowed arteries during walking. So this is pictured in the top right. They have a blood pressure cuff on the lower leg, and they're doing ultrasound in the lower foot. The ultrasound is special and such as the Doppler ultrasound can help your doctor evaluate blood flow through your vessels and identify blocked or narrowed arteries. The next test that they can do is an angiography, which is dye injected to your blood vessels. This will allow your doctors to view blood flow through your arteries as it is still happening. Your doctor can trace the flow of the dye using imaging techniques such as X-rays, magnetic resonance angiography, also known as an MRA, or computerized tomography angiography. Another way is catheter angiography, and this is the most invasive procedure, and it involves a small hollow tube, also known as the catheter, through your artery in your groin into the affected area, injecting the dye. This allows your doctor to treat a blocked blood vessel at the time of diagnosis. After finding the narrowed area of a blood vessel, your doctor can then widen it by inserting a stent or a tiny balloon to widen that, and it helps improve blood flow. The last test that you can do is a blood test. So just a sample of your blood can be used to measure your cholesterol and triglycerides and to check for diabetes, which are all puts you at risk to have more frequent tests for PAD. Treatment. There are a few different treatments that you can do. Some are at home and some you have to talk to your doctor about. So stop smoking is the first one. You can do that at home with or without your doctor telling you that you should, and exercise. You can also do that at home as well. Your doctor should talk to you about statin therapy to reach your goal low density lipoprotein level of 100 milligrams per DL or less. Another treatment is antiplatelet therapy with 75 to 325 milligrams of aspirin or 75 milligrams of clopidogrel daily. So some people, if they already have high cholesterol, high chances for this, they can take a baby aspirin a day to try to prevent this. But taking more medicine, you should consult with your doctor first before just taking the medication on your own. So patients with lifestyle limiting claudication should be considered for a trial of kilostazol, also known as Pledol, in the absence of heart failure. So the return to participation considerations. There are two main goals that we want to achieve before letting somebody participate in their sports, their activities of daily living. So we want to make sure that they are managing their symptoms such as leg pain before they can resume their physical activities. So no pain, and then stopping the progression of the atherosclerosis throughout your body to reduce the risk of a heart attack and stroke. So these are two things that we want to look for before we can consider releasing somebody back to their activities, their sport, and their daily living if it's a lot for them to do. How this impacts our transition to practice as an athletic trainer. So regular exercise increases the blood flow to the legs, so the chance that an athlete develops PAD, it's lower than most people, but athletes are more susceptible to developing venous disease due to the intense physical activity that is known to damage the valves of the leg veins. So that repetitive, high-intensity movements predispose athletes to vascular diseases, including arterial pathologies, by exerting increased pressure on neurovascular structures. So for this, we just want to make sure that the athletes are aware of this, and we, as athletic trainers, look out for these signs and symptoms. And if there's an athlete that has what we suspect to be an arterial pathology, we address that as soon as possible. So these are my references. There was also a reference of a poster used found at a clinical site. It was at SUMA. So thank you for listening.